Care for Uganda was founded in 2001 when two boys were put onto a sponsorship programme which paid for school fees, uniform, scholastic materials and food during term time. Working amongst some of the poorest children in an area called Bukasa and a slum area called Katongali, we soon saw the need to build a primary school. This was built, as was a small orphanage and a clinic. These have been handed over to Ugandan nationals to run. In 2007, Care for Uganda responded to a request to focus its activities in an even poorer rural area in Luweero district. In the early days of working in Uganda, we were very much an aid organisation. In other words, we saw a need and we would pay out money to meet that need. But once the money had gone, that was the end of it. And so we learned that actually development was the way forward. So we now try to help people to help themselves. So we have a slogan to offer hand-ups, not handouts. So we look for people who are trying to help themselves, and then we'll give them a hand-up so that they can improve the situations in their lives. A large part of our work in Care for Uganda is in child sponsorship. Here in Uganda, school fees have to be paid in order to go to school. And whilst the government claim that universal primary education means that that's free education, in actual fact, a child still has to pay for school uniform. When you're at school from 7 in the morning till perhaps 5 at night, there's lunch to be bought because you're not going to learn anything if you have an empty stomach all the time. So going to school is just far beyond the reach of many people here in Uganda. On the Care for Uganda sponsorship programme at the moment, we have 260 children, and yet there are many thousands of children who are still in need of this help that sponsorship can bring. For £18 a month, we can pay for a child to go to school, pay the fees, we pay the uniform, we pay for food throughout term time. By helping one child, you can help a whole family.
My name is Wanyana Rita, and I'm glad to see my sponsors again. They have been sponsoring me since I was 4 years, and they have indeed helped me, and I'm glad for that. I'm now 18 years. I completed schooling. Indeed, they did a good work. I appreciate what they did. They grew me up, they helped me, they fed me like my parents, they acted as my parents, and I'm glad to say that. May the Lord bless them.
In Uganda, malaria is the #1 killer. Mosquito nets can obviously help in the prevention of people catching malaria. The government do provide mosquito nets to some, but not to all. So Care for Uganda are trying to give nets where there are gaps. We've found in village situations that some people are scared to use mosquito nets, and the reason given is that they have these kerosene lamps with the naked flame. In a house the size of this, you may have 6 to 10 people and children running around, and you can see how this could easily get knocked over and a fire could start. Also, you can see very clearly how easy it would be for the mosquito net to catch fire. And so what we're trying to do in Care for Uganda is introduce the solar lamps, which obviously mean there will be no need to use the kerosene lamp, so it's much safer. Also, children trying to do their homework in the dark, because it gets dark here in Uganda at about 7 o'clock at night, can have a much better light with a solar lamp. We've been visiting in Namyeso village, and we've come across this family. There's mum and dad, 2 children and one of their grandchildren, living in this house which is in a poor state. I don't know if you can see, but the walls are literally falling down, and internally the walls are very precarious. This family are very worried that next time the winds and the rain come, the whole house will collapse. We've looked at this house with Lawrence, our operations manager, who used to be a builder, and he confirms that this is in a very dangerous state. Thankfully, we've been given some money which is going to enable us to take down the walls, Fortunately the roof is in good repair, so we'll be able to rebuild external and internal walls.
Hello, I've been asked to speak about the work that we do as a medical team in one of the most poor areas of Uganda. We have created a subcommittee of medical personnel, GPs, health visitors, midwives, and a couple of hospital specialists as well. And we're called FLOW, that means Friends of Luero. We've been going out for the last 8 to 9 years every year to help train local volunteers from the villages in very basic healthcare processes, sanitation, hygiene, immunization. We also help train the sort of midwives that they have there. They're called traditional birth attendants, people who don't have any formal training, and we are helping train them in safer midwifery practices. But one of the other things that we've managed to do is to provide 6 motorbike and sidecar ambulances for these very rural health centres. And this will help patients who are in need of better health care to leave the villages and get either to the health centre in a neighbouring village or even to a hospital in a neighbouring town.
When working in Uganda, it's easy to make the mistakes of the past. And by that I mean often white people have gone into situations, have looked around and decided what the needs are, and then thrown money to try and meet those needs. But we've discovered it's really important to talk to people where they are, to get them to tell us what they think the needs are. And so it's really important for us to work with people at all levels, so they can explain how they see the needs, and then as an organisation, Care for Uganda can sit down and see where that fits in with our development plan and where we're able to help, so that together, in partnership, we can make a difference.